I'm here because they wanted someone to talk about how hospitals are using social media, and I work at the University of Maryland Medical System. Been there for since 1999. And I'm sort of responsible for their entire web program. The content, the technology, all our websites, plus the intranets. I've been involved with web marketing from the early days. We're probably the first hospital in the country to use paid search. This was even before Google AdWords came around. This was something called GoTo.com, way back in the early days when you could buy a search term for a penny, and it was get a lot of traffic for $10. But been very interested in anything to do with the web, and in 2009 I started focusing on social media. What I realized in 2009 was that hospitals were on the same path to repeat what they were doing when the web first started to take off, which is ignore it and hope it goes away. Very typical in the late 90s when you would talk to someone at a hospital about, you should have a website. And people can come there, they can learn about what you do and all the things we know. And they say, well, why in the world would we have a website? Everybody comes to us through the yellow pages. So it took about 5-6 years to get over that, and we're about 5 to 6 years behind every other industry. And now here we come to 2009, and I start talking about you need to take Facebook seriously. You need to take social media seriously. And of course the response is, why in the world should we do that? Everybody goes to our website. So deep sigh, and that's when I decided to create a resource for the industry, which was my hospital social network list. And started in 2009 doing a survey of hospitals and created this list that tracked all the hospitals, links to their websites, and then links to all their social media properties. And by the time I was done with the list about a year ago, and the Mayo Clinic took over, we had something like 1,500 hospitals and links to over 6,000 social media sites. So it was there as a tool to help the decision makers in our industry understand that their peers are using this tool, their competitors are using these tools, and get that momentum kick-started. I'm not a doctor. I'm not a healthcare professional. I'm a web person first, and I can't imagine doing anything else. It's always a lot of fun. So that's a little bit about me. But what are the current realities of how hospitals are using social media? Starting out, again, after listening to the presenter last night with the negative stuff, and then I'm going to have a nice butt, and we're going to get into some positives. Our current realities of social media in hospitals is that a lot of them have a media presence, but first of all, social media is blocked at most hospitals. So if you work at a hospital, many times if you're a patient at a hospital, you're blocked from getting to Facebook and other tools. It's sort of seen as yet another outbound push tool. We have a Facebook page, we have a Twitter account, we're using it to tell people about news announcements and events and our latest award, using it to monitor what people are saying about us, reputation management. But we're not really using it, we're kind of scared to use it to actually encourage our patients to talk to us and to have a conversation with us. That's still a little scary for most organizations. The big perceptions, now that's a grumpy cat. And this was a face I would get over the last 5 or 6 years. Definitely from the IT people. I mean, that is definitely a look I got from the IT people when I talked about opening up Facebook in the office. Worries about HIPAA and privacy violations, IT security. A big one, of course, harkens back to our really hierarchical, authoritarian structure as healthcare institutions. We will tell you what to say about us and what to think about us, and we can't let our staff be talking about us because we can't control what they say, and we can't control what the patients are saying. So there were a lot of those fears that we had to overcome, and still are there to a large extent in many hospitals. I can tell you that at my hospital, we've had Facebook blocked for a long time, and I worked with my CEO, and he made the decision that we were going to open up Facebook across the hospital. A big part of the reason for that was patient satisfaction. The guest Wi-Fi that we have in the hospital is tied in through our network, So if you were a patient, you were in a hospital, your family would come in, they couldn't get the paper, they couldn't log in. And we're a tertiary care facility, we're an academic medical center, and we have some very sick people at our hospital. And I still remember one teenage girl who spoke at a leadership conference we had, who had a serious car accident and was in our facility for 2 months. And she was very popular at school. And she was talking about the great care that she got, and how grateful she was to our hospital. But she said, one thing really bothered me is that I couldn't talk to my friends on Facebook. And at the very time in my life where I needed that support the most, you cut it off from me. My mom would go home and print out 20 or 30 pages of comments from my friends and bring me in the paper the next day so I could read what my friends were doing, but I couldn't connect to them. And she said that was really detrimental to my recovery, because I felt like not only was I suffering this huge trauma, but I was cut off from my friends when I really needed to be part of their network. So that was one of the major reasons that we opened up Access. And once we opened up Access, we had opportunity to start using social media in a way that not only would address the things I talked about before in terms of monitoring and that type of thing, but also the opportunity to start using social media to help connect with our patients. This slide is from a PricewaterhouseCoopers study that came out in 2012. Now I see a lot of these social media studies, and the vast majority of them are based on garbage data and garbage process of gathering the data. This wasn't, and this was one of the few studies that I looked at their methodology and realized they actually had done it the right way. And they were basically talking to patients, to consumers, and asking them specific questions about what are your feelings about healthcare industry using social media. And lots of good data there, but this one slide was, they were asking the question, how likely are you to trust information you find on social media when it comes from your physician, or a hospital, or a health insurer, or a drug company? And you can see that the most trusted source is from their physicians, followed by a hospital, big drop off to health insurers, and of course the least trusted was drug companies. Now the ironic thing is that drug companies have all the money in the world to start doing all sorts of social media, but the group that the patients most want to hear from are hardly using it at all, and it's the doctors. So there's a lot of opportunity here to connect to our patients in the way that they want to be connected to. Now here's the but, here's the positive. As soon as we opened up social media in our hospital, which was 3 years ago, we were approached, I work in the communications department, so our department was approached by several nurse practitioners who wanted to set up Facebook support groups for the different patient communities that they deal with. And we worked with them to make that happen. So we have Facebook groups for different patient populations. They're closed or secret, so you have to be invited into it on Facebook. And it's sort of managed by our department in that we have the same set of guidelines on how the program should be run. And we have 4 different groups now. I think that might actually be, there might be a couple more that I've added in the last few months. Liver transplant patients, hepatitis C patients, people with very serious digestive disorders, these are lifetime chronic conditions, and trauma survivors. And they have between 50 and 100 members each. This is an example of one of the patient support groups, which is for liver transplant patients. And the person you see there, her name is Janet Gripshover, and she is a nurse practitioner. She's the admin of the group, and she's the one who came to us and said, I want to do this, but more importantly, the people in my support group want this to happen. They've come to me and say, this support group that meets once a month, many of us have to drive 3 hours to get here because we draw patients in from many states. We get here, we have a nice 1 hour meeting where everybody can see each other, and then we go home. Why can't we talk to each other on Facebook? And she came to us and we said, there's no reason they can't. And we set this up. And here's a good example of how Janet uses her admin to get good messaging out to this group. She's posting a message, a reminder for all post-transplant patients, when you get immunized for flu this year, make sure you get the shot and not the nasal spray. And then ask the question, have you gotten your flu shot yet? And then many people chimed in about that. Another one that I saw a couple of days ago, someone asked the question, someone who is a transplant recipient asked the question, has anyone met their donor's family? What's your take on meeting them? Now remember, this is a group of people who have all had liver transplants. So she's asking a question that would only apply to this very small niche group, and dozens of people responded. One person said, I had the privilege of meeting my donor's surviving sister. We started writing, emailing, and texting, and then we finally met in person last year. And there were many stories about the experiences that these recipients have had. One person posted a few weeks ago, I'm so thankful for the support group. You've all made my way bearable. There's so much love here. Only we know what we're going through. And again, this is, for anyone who's been following patient support groups on the web, the ones that people that find each other, there's nothing remarkable in any of this. What is different is that this is sanctioned by our hospital. We have a healthcare professional who is moderating and monitoring what's being said and stepping in to give information and advice. And it's a very trusted environment. A couple of weeks ago, there was some article about how people who have had transplants, received transplants, should be careful about owning cats as pets because of some risk of toxoplasmosis. So several of the people on the Facebook group started posting pictures of their cats and talking about how, my Fluffy is a threat to my life and having some fun about it, but there was some concern. And so within about 5 or 6 hours of that first post going up, Janet, the nurse practitioner, responded with a good 3 or 4 paragraph explanation of, well, that article kind of overstated things a little bit. Yes, we know about toxoplasmosis. It's not something we test for in the transplant process because the risk of it is so small that it doesn't merit having the test. If you're concerned about it, here are some precautions you can take. And essentially laid to rest the concern that these 100 people had that was raised, within a few hours was answered, and then they moved on. So that's really, I think, the most positive example of where the power of having healthcare professionals be actively participating in social media communities can have a really positive effect. So I'll leave it at that.